The Association of Resident Doctors at the Lagos State University Teaching Hospital has brought to the front burner the issue of proper welfare for medical practitioners. They say Nigerian government at all levels need to be proactive in this regard. Oluwa reports.
This was the last industrial action by the National Association of Resident Doctors. The core issue being the lack of proper remuneration for their essential services and minimal hazard pay made these doctors demand for their rights from the federal government. Have these issues been addressed?
The government have been paying lip service to addressing the issue of brain drain. And as long as that has not been addressed, I think that the issue of welfare of doctors is yet to be addressed.
One of the resident doctors mentioned that their hazard allowance still remains at 5,000 naira, which is below expectation.
The way and manner, is being done here in Nigeria with regards to remuneration, equipment, facilities, are the major issues that hamper this training process.
In discussing the state of residency training in Nigeria, these doctors highlight why many young doctors are not encouraged to go into residency program.
Sometimes you have the skills, you have the knowledge, but what to work with is not there. So if you look at all these things and what we call the push and the pull factor, and of course other out of the country, there are things like incentive that they are using to pull a lot of people to their claim.
They say the government is expected to do justice to the health system in Nigeria.
There is still a lot that needs to be done in terms of domesticating the Residency Training Act, particularly among state governments. Out of 36 states in Nigeria, only a few states in the country have really shown enough resolve to domesticate the Residency Training Act.
This program is to remind us that yes, the medical residency training exists, yet it may not be as good as what we want to be, but then we need to look at what next. How do we get people interested in residency training? With
the health sector budgetary allocation, which rose by 123.6% from 305 billion in 2016 to 682 billion naira in 2021, many Nigerians are still denied quality health care, while resident doctors are still underpaid. Oluwa, TVC News, Lagos.